Action.
Yes, it does. And I'm moving over here. The camera seems to follow me. It's scary. Okay, so dorsiflexion, you pull the foot up. Now, what are my grading scales? We'll start there so you have the remember, the recollection.
0
through 5.
0 through 5. What is 5?
0 is no contraction.
Full. Max.
Against
Be
force.
systematic about it. I'm a little OCD. So what is 5?
Full force. Full range of motion.
Full range of motion, full resistance. So I can put a lot of pressure on it, she can handle it. 0 means no contraction. What's 3?
That's where they can do it
Without
against
gravity.
Do it against gravity. So 4 is different grades of me being able to apply some pressure up to full, which would be make it 5. So in this position here, if I ask her to pull her foot up, her doing that without me touching her, that's a 3. Right? So if I want to assess she can't do it full range of motion in this plane, then what do? How would I modify this to go for 2, which is
Without.
motion outside? I'd put her
On her stomach.
probably
I don't know.
put her on her side. So you're going perpendicular to the plane of gravity. Right? So if you're side lying and I ask you to pull it up, you can pull it up, but gravity is no longer impacting us. Right. 1 means that she can't go against gravity, or she can't do it in the absence of gravity, full range of motion, so she doesn't have enough control just to move the joint, but we can get it, we can feel a contraction. Simple enough? Simple enough. Okay, so every time we do this, we're going to grade it. We're also comparing a bilateral, because a bilateral comparison is going to give us a clue as to how strong it is. Right? So I need to have something to compare it against. So I want to check both if I am checking one. So dorsiflexion, you're pulling your foot up. Right, so relax. Now bring your foot up. All the way, all the way, all the way, all the way, all the way. Good. And then we're going to go. Bring it up. Pull, 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 all the way, all the way, all the way, all the way, all the way. Good. So we're checking her full strength as we go. Plantar flexion. Now, you weigh more than I can push on a foot. Sorry, that's the wrong way to put it. So, because when you walk, you're doing a single leg propulsion, your body is geared to handle plantar flexion for whatever your weight is on a single leg push, which I can't really push against to manual restrict that. So if I'm going to manual muscle test this, I'll probably have her just stand up, single leg, and come up on your toes. So we're looking for control and balance that she can do it. Then switch sides. Can you do that one? Boom. And the fact that she can go against gravity, but that's all of her body weight with control, I'll give you a 5. Make sense?
What about for like 3 years?
So we can pull up the manual muscle testing book and see what they suggest. But that's when I can start providing resistance if she doesn't have the strength to do her body weight. Okay.
And would you still do that?
So technically, plantar flexion against gravity is probably stomach lying and pushing it up against gravity.
So if they
sense?
don't have like good balance, would you put it as a 4? Like if they
So
don't-
if she can't go all the way up against her body, then I'm probably looking at a 4, 4 plus, 4 minus. And that's where I would probably start looking at manual muscle, because then I can probably apply pressure that would hold, that would be able to resist her. But hop up real quick. So plantar flexion, push. And that's what's going to happen. She's going to slide back because the force of friction is not going to hold her in place. It's just not going to work very well. So this works so much easier, so much faster, so much cleaner. Okay, inversion, eversion. So inversion is coming here. So I want to assess your inversion. So push in, all the way, push, push, push. Good. And then I would do that bilateral. Push all the way and all the way, all the way. And then likewise, eversion, push out, all the way out, and push all the way out. So stabilizing hand is going to hold to make sure she's not like and trying to get leverage from some other way. And then your other hand is going to go distal to where you have adequate control of what's going on. Now the further out I go, the stronger I feel, because it gives me more leverage to push against her. If I try to resist her here, she's going to overpower me pretty easily. So come out as you as far as you comfortably can to get the leverage that's going to help you. All right. So plantar flexion, dorsiflexion, inversion, eversion, and then we do flexion, extension of the knee. So same idea. Stabilize here. Push out. Push, 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 push. Good. There you go. Extension, so that's extension. I would check a bilateral. Flexion, you've got two options. I can do that here. Pull down, pull down, pull down, pull down. But it's a little awkward because she's also going to try to hip flex at the same time. So for that one, I'd go lie on your stomach and go back. So you kind of get a feel for as you're doing these, some things just don't quite seem like they are working right. So here, we're going to go pull your heel to your butt.
Okay.
Good? So go, pull up, pull, 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 pull. And that way, her compensation, relax for a second, her compensation, we'll notice, is that she's going to start hiking her hip to pull accessory muscular transverse. She's got to be mindful. So you can kind of stabilize by dropping that down. Pull, push up, pull, 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 to where she doesn't get such arc, because she's going to fight a little bit trying to get that leverage. But it says bilateral, and do the same thing both places. So flexion, extension of the knee. Then we have the hip. So how do we do hip? And what motions do we have?
Abduction, adduction.
Abduction, adduction, rotation, internal, external, flexion, extension. So hip flexion is probably one of the easiest. So sitting here, we can get you to push up, and we can assess her range of motion, her strength going through that range of motion. Here, we can check a bilateral. So flexion, then we'll do extension. So we'll come back to extension because we'll have you do fewer gymnastics this way, but we'll do internal external rotation. This one's probably the trickiest one, because if I have you here and you internally rotate, then but if I flex your knee, it means your foot's gone out. So internal rotation is actually pushing your foot out. So stabilize, put your hand down, and push out against my hand, and then we're going to assess through that range of motion. So push, come on, push, 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 push. Good. Then we do that bilateral. And then likewise, we're going to go here for external rotation and push in. Push, 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 push. Good. So those are backwards because it changes where that femur rotates. It changes the position of that knee, of where the foot goes. That's the only thing that's tricky in this whole thing. So on your stomach, if you can lie forward. So hip extension. So the opposite, hip flexion, right? Hip extension. We have a group of 5 muscles. We have all of your hamstrings minus your short head biceps femoris, because it doesn't cross the hip. The rest of them are ischial tuberosity, and then come down. And what's the 5th one that's not hamstring? Sorry, we have 4. So what's the 4th one? What's your non-hamstring extender? Just run on the board. Probably have drawn on you this one.
Wait, what was the question?
What are your hip extensors?
Max.
Glute max. Thank you.
Yeah.
That was the last one we're missing. So we have your hamstrings, but then the glute max is in primary extender. So across the sacrum, across part of it, the bottom 2/3 goes into the femur itself, and the top third goes into the IT band before it comes down. Okay. So if I do straight leg raise, that's going to have a far more activation on your hamstrings. So stay there. I want you to go straight leg raise to where you pick your leg up off the table. So again, she's inclined to hike the hip on this. So this is another time where you want to kind of drop a forearm in there just to kind of make sure that you're stabilizing posterior iliac crest. So lift up, go. Push, 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 push. And good. So we'll check that bilateral.
That's flexion?
It's extension. Now, if I bend the knee, I'm putting slack on my hamstrings. So it's taking some of the pressure off of them, which means I'm going to isolate my glute max a lot more. So go again, push up, push, 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 and it feels a little different. Yeah.
So can we do either of those in our palpation?
That's still extension.
It's still extension. But this one is more glute max. This one adds the hamstrings in to assist. Which leaves abduction, adduction. So on your side. So abduction, quite simple. You're going to lift up here and push against. So stabilize hips so she's not falling off the table. Push up and comes up, and then we can check the strength. That's abduction. You're pulling it away. Adduction, if I get you to go, we'll go front right here. And then we're going to do in towards the midline. So push up, then back down. Now most of these, if you start getting into like rehab conversations, therapeutic exercise, you're good. Most of these manual muscle tests, we can actually modify